Welcome back, everyone, to Good Day. Now, continuing with the May mental health theme that we have here for this show.
That's right.
And turn awareness into action is this year's theme for Mental Health America.
That's right. North Country Community Mental Health has an array of Mental Health Month activities to remind us that taking proactive steps to understand and care for your own mental well-being isn't just self-care, it's also really an investment in your future.
Yes, and many futures. Here with us to discuss the events is CEO Brian Babbitt and Chief Clinical Officer Amy Christie. Welcome both.
Thank you.
So let's talk about where you guys kind of help with everything. Where you do cover in our area.
We serve about 4,000 people in 6 counties in Northwest Michigan.
Okay.
So, and I can actually name them. Sheboygan, Emmett, Antrim, I think I can, Kalkaska, Otsego.
Okay.
Tip of the mid counties,
There you go.
as I like
In
to call
Emmett,
them.
yeah.
Okay. Lots going on for Mental Health Awareness Month. Maybe you want to just jump into some of the activities and events you've got going on and why this month is so important.
Well, this month is important just to continue to raise awareness and acceptance of folks that have a diagnosis of mental illness or even intellectual developmental disability with co-occurring substance use. Our job is to promote mental health awareness, mental health wellness, and reducing stigma in the communities. So we are doing several different things throughout the month, and we're working collaboratively with Northern Lakes on promoting a Tools for Resilience group of educational opportunities. There are Tuesdays and Wednesdays throughout the month of May. They're at lunch and they're free. You can just sign up for those. Some of the topics are continued research in autism, child attachment, internet security, finding positivity in your life, stomping out stigma, so those kinds of areas.
Lots of stuff.
And then we have a lot of other activities going on, such as the State Art Fair, which is all art from individuals who have been diagnosed with mental illness, and they have a state exhibit that goes from county to county. So the state exhibit has 2 pieces of art from North Country Community Mental Health clients, and they'll be in 5 of our 6 counties. And then in the 6th county, in Charlevoix, our clubhouse, New Horizons Clubhouse, has its member art being showcased there.
I'm curious because, Brian, it feels like the stigma lessens with more awareness. And I just know for personal sake, have become more aware of the services and programs that have been offered over the years. And I'm just curious your take on whether the stigma is lessening, or are we gaining any ground as people become more aware, or is it just kind of a constant challenge you face?
I think we are. I definitely think it's a evolution and not a revolution, so to speak. May's Mental Health Month started in 1949, so it's been going on for a while. But I think the conversation has changed. I think to be able to talk about it lessens that stigma, to learn more about it lessens that stigma. And one of the ways maybe the conversation has changed is that this month is also about celebrating recovery, which is something that maybe hadn't been talked about for a long time, and it's really important to acknowledge the accomplishments of people with mental illness and recovering.
And a lot of those stigmas are generational, I think you can say, where, back in the day, men weren't supposed to share their feelings, weren't supposed to show emotion. And as we're getting to the younger generations, it seems like more are starting to open up. But what are some of the bigger hurdles that you see with people coming in that might be kind of stigma related? Are there still those big hurdles from years ago, or is it a little bit new stuff that's coming in the door now?
Media plays a role in it. This is really positive communication. There's also negative communication.
Right.
So whenever you see, a tragic event in the community, there's a potential to further stigmatize folks and stigmatize mental illness when chances are those 2 things are not related at all.
Right.
People with a mental illness are much more likely to be a victim than they are a perpetrator, and that really gets lost. So some of the media coverage and the focus is both positive and negative.
Right, and social media could probably go hand in hand.
Yeah,
with that
it
too.
does. Yeah.
Amy, let me ask you about maybe the age range of some of the folks that you're helping out, and maybe that relates to stigma too. It's a conversation that I've had with my kids about their own mental health, and whether we should see counselors at any point in their adolescence. Conversation that I don't think I had as a teenager. Are you seeing more of that, and how important is that conversation to the stigma?
It's very important. We're seeing more and more families bringing in children to get assistance and advocacy and services. And we also even serve pregnant mothers who have a history of mental illness themselves through our infant mental health program. So we basically go from birth to death because we do have specialized programs for individuals who are older adults as well.
Brian, we've got about 30 seconds left. Leave us on a positive note here where we can find more information and maybe how we can reach out and help our neighbor.
Sure. All of this information is on our website at nococmh.org. You can find not only resources around mental health as May is Mental Health Awareness Month, but also other community resources and information about our services.
Thank you both for
Thank
being
you.
with us. Great to have you. We'll share all this information and resources as well over on 9and10news.com.